Couple questions.
Governor, school starts next week in Sarasota and Manatee. What do you say to those who are concerned about this highly contagious new Delta variant spreading in schools?
So a couple things. One, parents can choose how they want to equip their kid going to school. We believe parents have that right. I think White House tried to say I prohibited parents from making that decision. It's just the opposite. We're empowering them. Number two, there's no data to suggest this is any different in terms of severity on kids. I think kids are very low risk, and I think the cost of keeping them out of school would be catastrophic, and we're going to have the schools open. We need the kids getting the education, and I'm confident that things will go well. And I'm also, these things have cycles to them, so as school gets going, hopefully we'll be on the other side of the wave, and I think people feel a lot better about it that time.
Governor,
yes?
What are you going to do about the rising rates? I mean, it seems like our rates are rising all the time, even the highest in the country.
Well, I would, so we had, I would say the rate of growth has actually slowed, even in the cases, although I don't think that's the best thing. The best indicator to look at where we're going is the ED visits for COVID-like illness. And so that has basically leveled off since last week. I'd like to see that go down. Once that starts going down, then the other indicators will follow. So we had really and this is the same life cycle that you see repeated so many times. It's the same life cycle as last summer, which is our COVID season. It's the same life cycle you're going to see in the Midwest and the Northeast when the season changes. We're about 2 to 3 weeks later in the summer when we saw the rise than last year, but it goes up, it expands very, very quickly, the growth slows, it plateaus, and then it goes down. So those ED visits, we were happy to see resistance at the level that it was, and I think you're going to start to see that turning down, and that's basically right on schedule for what we had last summer and what all these different viral cycles have done. But one thing that I'm excited about or pleased about is we did seniors first on the vaccinations, and the reason was because 80+% of the mortality was in senior citizens for COVID. The CDC did not recommend seniors first. I looked at the data and said that's what Florida needed to do. So we did it. We've done almost 4 million seniors. I think CDC says 91% of seniors have gotten a shot in Florida, and that's been done really for months and months. Since the vaccinations, we've had a 90% reduction in nursing home mortality and an 85% reduction in 65 and up mortality. And I think you're seeing that now. Those folks who are the seniors who pretty much our seniors are protected. Unfortunately, people can still get infected. I think we hope that it would be sterilizing immunity. And so we build herd immunity. We've had 25,000 fully vaccinated Floridians test positive since May 1st. And Vern Buchanan is one of them. And maybe some others are. Medical privacy, so some people are kind of frustrated because they're like, well, wait a minute, I took this and I still got infected. But what you're seeing is the severity is much less in those cases. And I think if you talk to the hospitals, they say that the severity is less due to the seniors being vaccinated. So for example, Tampa General, their median age of hospital patients with COVID is 47. You go back last winter, it was like 60 something. And so obviously the lower the age, the less likely you're going to see mortality. So I think that doing the seniors provides a protection. I'm a little surprised that people have been testing positive who were that, but that's ultimately reducing the severity, I think, is something that we all want. And again, when you're down 70, 75, 80% in mortality, that's a really good thing. Yes, ma'am.
So, Governor, you can get a COVID test at so many different private retailers, but for whatever reason, some doctors are saying that right now there's a need to reopen test sites in counties including Hillsborough. Could you look at the need and potentially reopen some
So those sites, so what we did, we transitioned all of this to the local governments. They've got huge amounts of money from CARES Act. And they can obviously, if that's something that they want to do, our view is that this is so available throughout society right now that that people obviously have an opportunity to get tested. You can actually buy a test and just take it home and do it yourself with these Buy Next Now and some of those other things. And so I think that that's good. Also, by the time, but I think that the locals, if they want to do it, they have resources to be able to do it. That's fine. We think that the tests are readily available, and quite frankly, we spent a lot of money on the testing. I'm not quite sure that, I don't think it did anything to bend the viral curve. I know sometimes people want, and now when there's higher prevalence, people want to go out and test, and that's fine. But at the end of the day, we didn't have that last year. Last June, July, the only way you could get a test was really through either a hospital or through some of the sites that we had. And it was very, very difficult. So we made the best effort to do it. Now, and it's similar with the vaccines, we don't do the vaccine drive-through sites like we did in January because they're really in every pharmacy at this point, and people have very easy access to be able to do it. And I think the same thing is done with the testing. But look, we're looking at these, the slowing rates. I think that with the COVID-like illness, we're going to keep watching that. When that turns over, then I think you're going to see the other indicators turn over. But at the end of the day, having protected all those elderly people was really what we worked very hard to do. We've done it, and I think you are seeing positive benefits given that the mortality year over year is so much less. So let's just keep our fingers crossed that keeps happening. Thank you.